I am Bobby Makasayat, Chairman of Maxicare Healthcare Corporation, the leading health maintenance organization in the Philippines. And today we are extremely privileged and fortunate to have as our first guest Dr. Edsel Salvana, Director of the National Institute of Molecular Biology and Biotechnology at the National Institutes of Health at UP Manila. He's also an Associate Professor of Medicine at the UP College of Medicine and an Adjunct Professor for Global Health at the University of Pittsburgh, as well as an attending physician at Medical Center Manila. Welcome, Dr. Salvana.
Thank you very much, Sir Bobby. It's a pleasure to be here, and it's indeed an honor to be on your inaugural podcast and also to help spread good information to your Maxicare members.
After all, we are still in the midst of a pandemic, global pandemic, and in everybody's minds, all the issues surrounding Covid-19. So perhaps the best way to get started is if I could ask you, we're going close to a year now when the virus was first discovered. And so we've been in various stages of lockdown and quarantine here in the Philippines. Perhaps as a way to update things for our members, could you give us a summary of where we are today, where we stand as far as and how has the Philippines as a country done during this pandemic?
Yeah, so that's actually a pretty complicated question, but I think that maybe what I can do is kind of show how we've done from the very start in terms of our response and how we've actually kept deaths low and also preserved our healthcare system. Now, when you have a new virus like COVID-19, SARS-CoV-2 is the virus that causes COVID-19. There's absolutely no immunity to it at the very start. So all of the people in the world are susceptible to this virus. And because we know very little about the virus at the start, it's really dangerous because we don't know the behavior. But very early on, yung sa January, with the outbreak in Wuhan, we saw how serious it could get. They had to lock up Wuhan, which is a really important city. It's like Chicago nga daw in the United States. Can you imagine closing Chicago? That's exactly the level that they had to do with Wuhan. And you know, the Chinese don't do these things lightly. So dun pa lang, when they closed down Wuhan, when they locked down Wuhan, that was already kind of alarming to us infectious disease doctors. And we knew that this could potentially be the big one. We talk about the big one like the Spanish flu in 1918, the once in 100 years pandemic. And so doon medyo tumaas na yung antena namin. And then it started to spread, South Korea. We had our first cases towards the end of January. And we had about 3 Chinese cases. Wala pang Filipinos na infected locally at that time. And then there was a 1-month period from the end of January to the start of March where we actually had no cases. And when you see that, kasi we know that it takes about 14 days for the virus to manifest. 5 days yung average, 14 days at most before you manifest. And so that's what we call a maximum incubation period. In epidemiology, when you have 2 maximum incubation periods passing by without a new case, that means you contained it. So that's why at the end of February, sabi ng WHO, oh, congratulations to the Philippines, you actually contained the virus.
Was there a specific reason, was there a specific reason why that the period of no cases occurred? Did we do something right? Because I don't think we were, I don't believe we were not under lockdown yet, no? And I don't know if there was a lot of information about the severity of the virus, but what would you attribute that no case situation to?
Right, we weren't on lockdown, but actually if you went to any emergency room in Manila, they had all these signs, and if you even said as much as, oh, I came from China, They will actually put you in an isolation room and you will get tested. That was the thing that we did, and actually we did that very well. And the other thing was towards the end, shortly after, actually they already banned flights from China and going there as well. And then in February, that's why there were a few countries, including the Philippines, that WHO said, there's been too long incubation periods, you contained it. And then, of course, no March, the next day, we had 2 cases. And then, so patient number 4 was Filipino, but he had come from Japan. And we know that there's community transmission ongoing in Japan. And that made sense. Patient number 5, for us infectious disease doctors, yun yung pinaka-problematic because this was the patient from San Juan who had no travel and had no contact with anybody who had known COVID exposure. And so we knew that when you see somebody from the community with the disease, that means hindi isa lang yan. Most likely there's several because they probably got it from somebody who came from there. That's good if it's a first generation contact. If it's a second, third, fourth generation, mas lalong madami yan. So that was at that point, that was around March 10. We only had about 10 cases at that time. Pero those of us, I already sat on the technical advisory group of DOH, and they were asking us, there's several of us from the academe, what do you make of this? And we told them na, medyo delikado na to. The fact that we have 10 cases, we have to think about shutting down at least a small portion of Manila, maybe yung sa San Juan where the case came from. And nag-suspend na ng classes actually yung San Juan at that time. And the rationale for this was twofold. First, we saw what was happening in Wuhan. The second was, this was the time Italy was getting overwhelmed. We were getting all these reports na people could not get into the hospitals anymore kasi wala ng kama, people were dying at home. And people in Italy, in Spain, they have doctors like us who are very, very smart. And they're very, very advanced countries. Meron yung thresholds. Pag nakita mo na ganito na kadami yung mga tao, meron ng community transmission, then at some point you say, okay, it's time to lock down. They had not reached that threshold yet. They already got overwhelmed. And so, yun yung thought process sa amin. Like, oh my God, we have what, 10% of the healthcare capacity of the US? And if a country as advanced as Italy, not just Italy, northern Italy, which has the strongest healthcare system, one of the strongest healthcare systems in the whole of Europe, could get overwhelmed, pupulutin talaga tayo sa kangkungan kung wala tayong gagawin dito. And that's why we made the case. March 13, 52 cases pa lang. Sinabi na namin sa IATF, I think it's time to lock down because we do not have the healthcare capacity of those advanced countries. And sila pinupulot sa kangkungan ngayon. Ano mangyayari sa atin? It was terrifying to us. In fact, when I went before the IATF to make the case for the early lockdown, I pretty much told them, every disaster movie starts with someone ignoring a scientist. And I told them, I'm the scientist. And I'm telling you, this is bad. And that's actually how we convinced them that an early lockdown may actually save a lot of lives. And now looking at that decision, it was absolutely the correct decision. Kasi Mexico, which has similar population to us, we used to be a province of Mexico under Spain, and then they're also packed there. So I actually like using Mexico as kind of like a comparison. They locked down 10 days later than us. They have 10 times our cases and 10 times our deaths. So even just a small delay in the decision to lock down, exponential yung rise. What we didn't anticipate though was yung demand for testing, because this is not something that's easy to do. And it wasn't just us. Actually, a lot of countries had shortages. Places like South Korea, where they actually make the kits, they did well. Pero there were a lot of countries, even the United States, they stumbled nga on their first RT-PCR kit. And so they had problems with that. So it wasn't just us. At this point, when we locked down, we peaked at around 500 cases sometime in May. And then we started to go down na after that. And there was a lot of contentious issues. Syempre, nobody likes being in the lockdown. People were losing their jobs. Businesses were going under. And so there was really pressure to open already. Although we reopened gradually. The other thing was that yung number of cases, di ba, at that time there was a lot of criticism na, okay, is this what you call a flat curve and everything, 200, 300, 400 cases? If you look back to that now, where we're pulling 2,000 to 5,000 cases a day, it wasn't that we didn't flatten it, it's that we actually preempted it. In other words, because we locked down early, instead of rising up, it actually stayed down. And that's exactly what happened in Czechoslovakia as well, where they used masks for everyone. And then now, naging kampante sila, they opened up too quickly. Now they have one of the fastest growing epidemics. That's the problem with this virus. It will hit you, it will surprise you if you let up. So ano nangyari? So it was already kind of, 200, 300, and of course our economy was going like that. We opened up in April and May. And then we started to see the increase na talaga around June. And there's 3 reasons for this. First of all, we were repatriating so many OFWs. Kasi we already locked down everything. Sarado yung airport eh. But to date, we've repatriated 470,000 OFWs. About 10,000 of them are positive. So may pumapasok. It's one of the problems. And that's the difference between us and Vietnam. Vietnam didn't repatriate too many OFWs. We were able to control the pandemic in NCR by locking down, pero pasok ng pasok yung OFWs. But they had nowhere to go, no choice, di ba? So we're gonna take that hit talaga. At the same time, number 2, we were seeing a new variant of the virus that was 3 to 9 times more transmissible. It wasn't deadlier, but it was more contagious. And we have genetic evidence that it's already here in the Philippines around June.
Was that brought in possibly from outside, this new variant?
Yeah, absolutely. That's exactly where it came from. Kasi it's a European virus. The closest related to it is one from Germany. But that's not the only introduction. And then the third, of course, was that we were opening up. So there are more people coming in talaga. So one of the questions, though, and this is a recurrent thing, kasi we keep saying, okay, we contained it in January. What's my proof for that? We did genetic analysis, whole genome sequences of these viruses. And the variants that we saw in January, there are no other viruses in March, April, May, June that are even remotely related to that January virus. So we really contained that. As pumasok, yung March viruses, pumasok yon as separate entry from different countries na. Kasi the strain of I don't want to call it strain because there's only one strain right now actually of COVID. There are variants. There are specific terms that we use but these are just genetic variants, genetically distinct viruses, or lineages is the other term that we use. It's very different from the January. So, pumasok talaga to. And, this is still an underestimate because we have maybe 20 viruses that we've sequenced, but we already know that those 20 viruses came from different places, including Europe, India, Japan, South Korea. Umikot na talaga tong mga viruses na to. In fact, if you look at New Zealand, flat, broken ang curve nila, di ba? They had 270 separate introductions of the virus. This is not something that you can keep out of a country talaga. You really have to make sure that you are able to identify the cases early and control them. Otherwise, kakalat at kakalat talaga yan. And as long as you have people coming in, the virus will keep coming in. So that's what happened. So we had that surge, June and July, and then we had the timeout around August. And then now we see that this is starting to go down. Mukhang na-control naman. The other problem was in March and also in July, the healthcare system started to get overwhelmed. And that was what we were really, really scared of. We actually just shut down in the nick of time. Because if you remember in March, everyone was running out of PPE. Everyone was, the ICUs were full. And so what we were able to do with that early lockdown and then the subsequent timeout was that we were able to prevent the healthcare system from getting completely overwhelmed. Kasi once your healthcare system is completely overwhelmed and you can't admit the severe and critical cases, all of those severe and critical cases will die. And that's when your mortality rate will shoot up. A good example is, so our mortality rate right now is about 2%, which is the same as Hong Kong. The world mortality rate is 4%. Spain, France, Italy, mortality rate, 10%. These all happened early on, nung sa surges nila, because they were not able to admit those patients. Ang US mortality rate is also about 3 or 4%. So, yun talaga yung pinaka-important, is that you protect the healthcare system, you prevent people from dying. Kasi even though there will continue to be cases, if you're able to take care of them and spread them out over time, you can keep the mortality low because we already know how to take care of patients. We already know how to optimize them. And that is what the lockdown brought us. We were able to learn, we were able to preserve our healthcare system, and we were able to increase our healthcare capacity. So going back to the original question, how have we done? Okay, so we have about 380,000 cases, but only just under 7,000 deaths. That's pretty incredible considering Metro Manila is as crowded as New Delhi. Okay, imagine the US has more than at this point, I think more than 220,000 deaths. Italy and Spain have more than 30,000 deaths. We have 7,000. That's pretty good. Of course, if we look around at our neighbors, Vietnam, Thailand, Singapore, they have done spectacularly well. Although per capita, actually, Singapore has more cases than us. If you look at per capita, kasi 3 million people lang sila, they have about 60,000 cases. But, you know, there are differences in testing rates, in positivity rates. So it's very difficult to make straight up comparisons. But the one thing, for me, the one thing that really comes out when you're trying to save lives in a pandemic, it's really how many people die. Because you can't get that back. Kahit 1 million pa yung cases mo, kung mabuhay lahat yon, no problem. Buhay sila. Pero people who die, they're gone forever. And so you would have been remiss if you didn't do everything in your power to prevent those deaths. And by preserving our healthcare system, by locking down, and also making sure, actually, okay, talagang Filipinos in terms of making sure they're wearing masks and face shields and everything, we can weather this storm and keep the deaths low until we get the vaccine.
That's a terrific summary, Doctor. And so I'm assuming, based on what you've said and explained, you're fairly proud of what the country has accomplished, despite what may be appearing in social media platforms and people frustrated about certain things, and even the challenge of what our economy is facing. So,
I think we could have done better, definitely.
Sure,
I mean,
sure.
There's always room for improvement naman eh. And of course, our neighbors have done really well. And I wish that that's what we were able to do. But, you know, Filipinos are Filipinos. You know, we have our own kinds of resources. We have our unique issues, like with a lot of OFWs, and also the crowding in Metro Manila. But, you know, if I think about what could have happened if we hadn't shut down early, even WHO and the World Bank are saying tens of thousands more deaths. And that's not hard to imagine because Italy and Spain and France exactly ganun na nangyari. So I think that we could have done things better, but we did pretty well. And yun nga, we kept deaths low and we preserved our healthcare system. But it's not over yet.
I want to also ask you a little bit more about testing. In a recent webinar that you conducted for Maxicare, you used the phrase "effective tool." No, and I listened to the webinar, and I got the impression that you have perhaps you have more reservations about the effectivity of testing, whether it's a PCR test or an antigen test or antibody. So, how would you use, if in your position, and if you had to advise advising the IATF, for example. How would you use testing as an effective tool? What sort of setup or idea would you have that would make testing as at least effective as opposed to not being effective? Because that's first and foremost on people's minds when they want to step out of the house or go back to work. Should I be tested? Is a rapid antibody test good enough? I mean, an RT-PCR test takes several days. It's so expensive, and so there are all these questions in people's minds. And so, how would you use testing and make it an effective tool so that people can make these decisions in their day-to-day lives under this pandemic?
Yeah, so testing kasi is just one of the tools that's in our belt. As physicians, we treat patients, we diagnose patients, and we use tests. Now, if there was a perfect test that could say with 100% certainty that you had either the disease or you did not have the disease, and it's good for, say, 1 month, then I would say test everybody. But the problem is that our best tests are only right 2/3 of the time in patients who have disease. So you're always going to miss 1/3 of them. The second is your test is only good from the time you took it going backwards. In other words, if I test you and you're negative, but you got sick the moment you stepped out of the laboratory, then that test is not capturing what you are currently. So your tests are basically only cross-sectional for a single moment in time. And second is that they are inherently, there is about a 1/3 chance it's wrong if you're positive. So those are the things that are problematic with testing. And that's why you can't use testing as a standalone strategy. In fact, they calculated what would happen is if, you stop doing everything else. No symptom screen, no mask, nothing. All you have to do is just test. And you do RT-PCR on 5% of your population every week. Like 5 million people test every week. And you don't do your contact tracing or anything. It's just testing. And then if you find somebody who's positive, then that's the time you isolate them. The effect of that will decrease transmission by a whopping 2%. It's not going to work. It's completely
that is
useless.
Interesting.
Yes, precisely because you spent all that money, but your test is only as good as, kasi kung walang risk yung tao, there's no point in testing. Baka mag-false positive pa nga yan eh. Wala siyang disease, pero nag-glitch yung test, tinawag mo siyang positive. So that's the other problem. So the overall effect, so I'm not saying you don't test. Anybody who has symptoms should be tested. Anybody who has exposure should be tested. But say somebody sitting in Batanes where there are no cases, you do not need to test those people. That's a complete waste of money. Pero what are the things that work in terms of, kasi what we want naman when we're doing tests, when we're doing these interventions, is to decrease the risk of transmission. So one of the best tests for interrupting transmission is a symptom screen. Why? Because about 70 to 80% of people with COVID will have symptoms. There's maybe 10 to 20% who will end up asymptomatic throughout their whole course and get better. Pero yung 70 to 80% na yon na nagkakaroon ng symptoms, they will transmit the virus for about 10 days. And compared to someone who's not coughing and sneezing, somebody with symptoms will transmit 10 to 20 times more than someone without symptoms. So if you start with a symptom screen, you take out 80 to 90% of the people who could potentially transmit and more than 92% of the transmission risk. Kasi these are the people who really do transmit.
That's interesting.
Yeah.
Symptom, if you're looking for symptoms, then taking a temperature at say if a person enters a room or a building, that is one way, because I understand fever is or a certain temperature is definitely a symptom. So perhaps we should be investing in better temperatures, temperature gadgets to better, or at least maybe train the people to, other than security guards, to make sure that they're doing the right way to capture whether a person has a temperature or not. Is that something that is
it's
possible?
The whole thing. Yeah, it's not just the temperature. Remember those little pieces of paper that ask, do you have a cough?
Yes.
Do you have a cold? Were you exposed to someone? Dapat may magbasa talaga nun. Kasi kung may ubo yung tao, wag mo nang papapasukin. So,
but then
you do that. Yeah.
If a person, I mean, I've filled out some of those contact tracing forms and automatically no, right? But if the person in who is doing the check in front of the building possibly notices, then maybe that's a better way as opposed to having just a form filled out. Is that something that you think would be effective?
Yeah, I mean, the problem lang nga is, people lie and people will suppress their cough even though kating-kati na yung throat nila parang habang dumaan lang sa car. I mean, we understand it's imperfect, okay? But if you do it properly, it will take out 92% of the transmitters.
Interesting.
Okay?
Yeah.
So that's for like casual people coming in. Pero if you're talking about work, for instance, you can do it stricter, di ba? Kung papasok yung mga tao to work, you can actually have occupational health screen them every day, give your form, and then take a look at them, do the... So, yung mga ganon might be a little bit more effective. But that's not the only thing we have. That's just the first thing that might work. Okay, so that's the first. So, doing a symptom screen, as opposed to missing 1/3 of patients, when you do testing for everyone, is already going to take out 92% of your transmitters. So we're still talking about there's 8% na makakalusot. So how do we decrease the risk for those 8%? If everybody wears a shield, a face shield, a mask, and physical distances, so yung mask is about 85%, yung shield is about 78%, yung physical distance of more than 1 meter is about 80%. Taken all three together, it's more than 90%. So yung 8% na natitira, you decrease it by another 90%. Ilan na lang yung matitira doon? So your residual risk goes down to 1 to 2%. And then if you really want to test, you're just looking at that, you're looking for those 1 to 2%. And you're going to spend, if you have 10,000 people in your company and you test them every 2 weeks, with RT-PCR, you're going to spend 30 million pesos every 2 weeks to decrease the risk from 2% to maybe 1%. You see why it doesn't make sense? Why we're going to do this testing on top of everything else? I mean, you can if it's really important, because we know naman one case can be a super spreader, di ba? So, but again, we're protecting all our employees. So, okay lang yon. If you're talking about, say, the PBA bubble or the NBA bubble, then you can do the testing strategy. Kasi even one person can destroy the whole bubble. So that's one thing. But that's a lot of money. And it's not sustainable. You can't sustain that for work. But the more effective interventions are really those that are proven to work. So, symptom screen, mask, distance, and then other things you can do. Pag nagkaroon ng sakit ng isang tao, isolate agad. That decreases the risk of transmission by about 26%. If you put them in a facility, it's about 35%. If you isolate the whole household, that's another 37%. So yung mga ganong interventions, they add up. That's what they call the Swiss cheese strategy. Walang perfect intervention. Isipin mo slices of cheese, Swiss cheese, may butas. Pero hindi aligned yung mga butas. So pag pinagtapat mo yun lahat, hindi makakalusot yung problem mo. So you can really bring down transmission by over 90% even without a testing strategy in place for your for your business. And the testing strategy will be ridiculously expensive and will still miss about 1 to 2% of cases.
That is great advice to any of our members who are listening, that either are CEOs or run companies with a lot of employees. It's a lot of food for thought and how they choose to bring back their employees, because some companies have actually asked Maxicare for advice, and it's a really difficult challenge, and especially when the easing up started several months ago, we weren't really certain as to what how good the tests were. We were all trying to just understand how effective they may or may not be, but clearly you combine that with the symptom tracking and very very common sense interventions. There is hope that companies can bring large number of people back and get businesses up and running again.
Yeah, absolutely. And I mean, I'm not saying don't test. If somebody has symptoms, of course you should test.
Yes.
If there is an outbreak, you test every single contact that you can find and make sure you quarantine them. Pero yung testing na you can only come back to work if you have a test, that just doesn't fly. It doesn't. The other thing was when they started using antibodies, half of those positive tests were false positives.
Mm-hmm.
So you were actually preventing people from going to work who actually had no disease, and you were doing contact tracing, wild goose chase, kasi you called these people positive. In fact, they were not. So it's really a waste of resources. And the other thing about antibody is none of it will be positive within the first 7 days of symptoms. So inuubo ka, negative yung antibody test ko, pwede mong palusot yan. Yung pala, mali lang yung test na ginawa mo. So that's even more dangerous. Whereas with the symptom screen, you would not have let that patient in.
Terrific advice. Let's shift a little bit to vaccines. I mean, this is something that everybody is anticipating or a little anxious about. There's talk of American, British, Russian, Chinese vaccines. Where perhaps explain in some way what are the challenges and hoping to manage our members' expectations about what to expect when an announcement about a vaccine is actually made by the either by the DOH or by whomever. It would be really useful to help people understand what to expect.
Right. So let's set expectations muna. We have the usual length of time that it takes to develop a safe and effective vaccine is 10 years. The fastest vaccine that has ever been developed, the mumps vaccine, took 4 years. 4. They were trying to develop one in 1 year. And here's the other thing on top of that. We have never ever developed a successful coronavirus vaccine. There are different kinds of coronaviruses. There are seasonal coronaviruses, which cause the common cold. And we have 2 epidemic, 3 now with the SARS-CoV-2. But the other 2 coronaviruses na epidemic are MERS and SARS. And we still don't have a vaccine for any of those. And so, just from an expectation standpoint, this is really something that is like a moonshot, okay? And how do we know that vaccines work? Well, yung sa phase 1, phase 2, if you see antibodies being made, especially against the spike protein, yung parang knobs around the virus, that's the one that it uses to gain entry to the cell. If you see antibodies, then that can block the transmission of the virus. So just based on that, it looks like it works sa phase 1 and phase 2 pa lang. But the only way to prove that a vaccine really works is if it prevents disease. And the only way to do that is to see in a phase 3 clinical trial whether the people who got the vaccine got sick much less than those people who did not get the vaccine. And that's what's happening right now. And so there are about 11 vaccines in phase 3 clinical trials, which is just the last step before you can use it for clinical use. There are about 42 vaccines in some kind of clinical testing, whether phase 1 or phase 2. There's more than 100 in preclinical trials. So, first of all, let's get realistic, okay? It looks like the phase 1, phase 2 antibody responses are good. But, for instance, HIV, we've been looking for a vaccine for HIV for the last 30 years, and we still don't have one. So there is no guarantee this vaccine will work, okay? But based on the early returns, there's a good chance it will, but it will not be like the measles vaccine, which is 95% effective. It's going to be more like 50 to 70%. Okay, that's going to be the first generation vaccine. So what does that mean? If we get lucky and we have an effective vaccine by November or December, of course they have to manufacture it and distribute it and everything else. The vaccine is not a slam dunk. It's going to need help pa rin. So even if we're giving the vaccine, it works 50 to 70% of the time, we still need to use our masks. We still need to use our face shields. Otherwise, more people are going to get sick and more people are going to die. So this is not like, we have a vaccine and then the next day it's all normal. No, that'll take maybe the better part of a year to get that vaccine out and running. And remember, it's at least 2 doses for most vaccines. You get 1 shot, and then after 28 days, you get another shot. There is one vaccine, the Johnson & Johnson vaccine, that only requires 1 shot. And it also looks interesting that the data is encouraging. But we won't know until we have the phase 3 data. And the earliest that data is going to be seen is probably maybe the end of October, more realistically, maybe first week of December. We keep moving that. Dati September, baka meron na, then October, then November. Realistically, right now, Dr. Fauci says about first week of December.
Oh. So, given that there appears to be a lot of uncertainty when and if a vaccine is actually announced, and assuming there's a successful manufacturing it in the numbers that are required and distributed, what would you advise people to think about, or how would moving forward, given what you've explained about testing and symptom tracking and tracing, and now with the challenges of really waiting for an effective vaccine, how would you advise people to what would you advise people? What would your advice be to people given these factors?
Yeah, I think we need to learn to live with the virus talaga. There is no shortcut out of this pandemic. Even if we get a vaccine tomorrow, it's going to take a while before the vaccine is good enough or has been given to enough people for it to have any kind of effect. Maybe the next generation vaccines might be 99% effective, and that'll hasten the timeline. But remember, the Spanish flu took 2 years before it went away. Some other pandemics lasted even longer. So I think that realistically, kasi they are doing things to shorten it. For instance, yung manufacturing, they're already starting to manufacture some of the vaccines in the millions of doses. Para kung yung lumabas dun sa phase 3 clinical trial, it's good. They already have several million doses ready to go. Of course, that's a gamble. If it doesn't work, tapon lahat yon. But they're willing to take that risk. So they're already manufactured. So they're really trying to shorten that interval. But again, we don't know what the vaccine will look like. The second is, how long will immunity last? We're already hearing cases of people getting reinfected. We don't think that's the rule. We think that most people will probably have some sort of immunity at least for a few months, maybe about 4 to 5 months. But beyond that is a big question mark. So that's why even if you've had the disease, we always tell people, you might still get reinfected. We can't be sure. So you still have to take precautions. That's why we always say, treat everyone as potentially infectious and treat yourself as always susceptible, whether you've had the disease or not. And then learn to live with these things that we use to decrease our risk. Mask, physical distance, face shield, decrease your risk by more than 90%. And the baseline risk, depending on where the community is maybe 5%, say in Metro Manila. If you go about your day, your absolute risk without a mask or face shield or anything, you have about a 5% risk of getting the disease. if you use your mask, face shield, and everything, it goes down to 1% or even less than that. So that's how your day should go. Now you're protecting yourself. I mean, kami mga doctors who see COVID patients directly, like me, thank God I haven't been infected yet, but I'm probably one of the most high risk because I see these patients directly. In fact, two of the initial deaths were mine, and these patients were not yet confirmed COVID when I saw them, so we weren't in full PPE. But of course, I was using an N95 now on all my patients at that time. I had a scare. I was in the hospital for 10 days because I had a sore throat. And then sinabi sa akin, these people that died actually were positive. Thank God mine ended up negative. But it works. I mean, we have hospitals functioning. We have doctors seeing COVID patients all the time in PPE, and it protects them. So to a certain extent, mas mababa naman yung risk ng general population. Of course, they're not walking around in spacesuits, but the mask, the shield, and the physical distance with what the baseline risk is, say, in Metro Manila, which is about 5%, should be enough to live with the virus. Of course, it's not perfect, but I think that we can sustain this long term while we're waiting for the vaccine.
That sort of says that if people adhere to the need or to the requirements of wearing face shields, face masks, there is minimal risk. And only, as you said, no, it's not. There's always a risk, right? So why do you think people are still being told that they can't go to a restaurant or a bar, or they can't go to a gym, and I'm sure that the business owners will do all they can to keep conditions, whether it's 20%, 30%, the equipment and all of that in as clean as possible. So why do you think people are still being told that it's not safe or it's there's still a possibility you might catch something so you shouldn't go? I mean, why do you think that's happening?
Well, it is higher risk if you eat in a restaurant when you take your mask off. That's one. Even with the what do you call this? Even with all the ventilation and everything, there is a higher possibility. But again, risk appetite yan eh. Also in terms of your economy. But the other thing is you have to be nimble. Kasi pag may outbreak, then you have to understand that we can do localized lockdowns. We're not going to do these big lockdowns anymore. Masyado magugutom when that happens. But when there's an outbreak, to prevent it from going around, it's better to really focus on these. This is when testing is really essential. When you have outbreaks, you have close contacts, and of course, isolation and quarantine facilities are very, very important when you have an outbreak, because our things don't. It's very difficult to just say mask lang yan and everything, and then nagkaroon ng outbreak, tas wala ka ng ibang gagawin. So these go hand in hand. There are things that are higher risk than others. So in terms of, say, if it's an indoor activity versus outdoor, mas mababa talaga yung risk sa outdoor. But again, we do understand that the economy has to open up. So the risk is there. We can try to minimize the risk, but the smallest risk is really what we call removing yourself from the risk. So instead of going out, sa bahay ka na lang, if you can live with that. That's the 100% way. So kung pwede ka mag-work from home, bakit ka papasok, di ba? Parang ganon. But if you really have to go, then, do that. Pero kasi yung mga leisure things where you might add more risk than is necessary, that's a gamble. That is a true gamble. And of course, we know that people's livelihoods rely on a lot of these things, massages, dining out, and that is really, really difficult. And I think that this is also why there's a lot of leeway for LGUs to make their own rules. The reason is, iba naman ang level of risk in each LGU, iba rin naman, and presumably the local leaders know the behavior of their people and that they can enforce when there is an outbreak. So it's difficult, but we shouldn't have to choose between the virus and the economy. Kasi matagal to eh. But if we learn to live with the virus, the question then becomes those gray areas nga. How much can we afford to open? Can we go instead of 10% capacity, go to 30%, go to 50%? That has an incremental increase in risk. But for instance, with Taiwan, they really did their work at the very start. So ngayon, open sila. They don't really need all these things. But it's a gradual thing. Kasi if you have an outbreak and you lose control of it, back to square one ka na naman. You're gonna, like what's happening in Europe ngayon, a second wave, back to lockdown talaga sila. Hindi nila makokontrol yan with just wearing masks at this point. Kasi masyado nang madaming may sakit and now overwhelmed na yung hospital system nila. They simply don't have any room other than locking down again. And that's what we want to avoid. We're already at that point where we've already proven we can control this even with our limited healthcare system. We know that it's not like in the US na mag-aaway talaga kayo para magsuot ng mask ang isang tao. Meron pa rin akong inaaway. Minsan nagsisigarilyo sa harap ko. Sabi ko, baliw ka ba? Wag mo akong papatayin. But we also have to be proactive like that kasi may mga matigas talagang ulo eh. But it's not just hindi lang yung person na yun nandadamay siya ng ibang tao eh. So we really have to do that. That's what it means to live with the virus. We take precautions, we protect each other.
Dr. Salvana, this has been a really interesting and fascinating conversation. I know you're a busy guy, so one last thing I just want to ask you before all this is done is, can you share a book that you've read recently, or a movie that you've seen, music that you listen to, something that will perhaps give hope or inspire people to continue facing the challenge of living with this pandemic here in the Philippines. Any book, any movie, any song that please share one or two things that might give us hope that we can overcome all these challenges in facing this pandemic.
Yeah, unfortunately, the last movie I watched was Mulan. Kasi I watch things with my daughter. So it's Disney. But Disney always has happy endings. The thing is, we should not be scared of the unknown. And we should also take responsibility for our own situations, despite whatever challenges come our way. First of all, we're parang si Mulan, di ba? Babae siya. She's in the circumstances dati in China na you were not allowed to excel, you were not allowed, you had to know your place. But this is a pandemic. All bets are off. So, I think what was really, really encouraging to me is how innovative and resilient Filipinos have been in this pandemic. In a way nga na-accelerate yung online payments, online things. So I think that kind of optimism. Of course, it's okay to not feel okay. Nakaka-depress talaga to. Our lives have changed for the foreseeable future. But Mulan being a Disney movie, there's always hope and that there will be a happy ending. You just have to power through it talaga. And and that's, I think, also where Filipinos excel. We are eternal optimists. We think the best of each other. And I'm very, very hopeful nga that Filipinos will continue to do the right thing and help each other out. Whatever, virus lang yan. Hindi kayang-kaya yan ng Filipino. Medyo nabugbog tayo pero hindi pa tapos yung boxing. And in the end, I think we will win.
Dr. Salvana, if people want to follow you are you on any social media platforms where they can read your writings? You mentioned a column that you write for the Manila Bulletin. Would you be willing to let people know where they can follow you on any of the social media platforms?
Sure. So I write a column on Manila Bulletin called Clinical Matters, and it comes out every Tuesday. I am on Facebook, Edsel Maurice Salvana, Just look it up. It's in there. I think I have about 70,000 followers right now on Facebook. I'm also on Twitter. It's a verified account, so it's not fake me. Sometimes there's fake people. So look for the one with the check mark. I have about 25,000 followers, but I'm not as active on Twitter kasi I talk a lot and I write a lot. So masyado maikli yung Twitter for me. So Facebook is really where I write a lot of my thoughts. I know some people don't like Facebook, but what I do is I clean up my feed. Pag may trolls talaga, dinidelete ko sila. So I try to keep I try to keep the thread safe for work. I don't necessarily engage as much, but I try to keep it clean. And I do put my thoughts there. They are my opinion. It's not UP or anything like that. But I try my best to give positive things and also to try to give some enlightenment on how things work. And then if you like TED Talks, I actually do have a TED Talk. It's about 1.3 million views now. It's on the TED.com website. Just Google my name. And although it's a little technical, it's about the dangerous evolution of HIV. It's about 4 minutes. So if you don't like it, it's not too long that you wasted a lot of your life. But please do visit those, and hopefully they will give you some enlightenment on what I do as a doctor, and also trying to give the best that we can for the Filipino people.
Dr. Edsel Salvana is the director of the National Institute of Molecular Biology and Biotechnology at the National Institutes of Health at UP Manila. He's an associate professor of medicine at the UP College of Medicine, an adjunct professor for global health at the University of Pittsburgh, and an attending physician at Medical Center Manila. Dr. Salvana, thank you very much for a fascinating conversation.
My pleasure. Thank you very much.